Usually for men seeking treatment for alcohol use disorder, usually it's a recommendation by a loved one or a provider. Usually what we've seen a lot is someone such as a partner, a spouse, a boyfriend, girlfriend, a family member, even a workplace employer recommending the male individual identified needing alcohol use disorder treatment. Usually for men who work in high stress jobs, such as in engineering or the legal field where stressors are 24/7, they don't necessarily feel like they can reach out for help or support. So therefore, alcohol use symptoms usually manifest in shoddy output, productivity issues, absenteeism, interactions that are aggressive with colleagues and their direct reports. Well, for men in general, the average body for male is usually almost double the weight in some cases. So therefore, a lot of times it may seem like men are able to absorb alcohol differently. Now, this works on the surface, but usually what ends up happening is that men are consuming more alcohol and there's higher levels of binge episodes, which therefore creates much more health consequences on the organs in the short term and also in the long term as well. Well, in generalities, men tend to rationalize or compartmentalize a lot of the issues at hand. So therefore, they end up having a very narrow window or a very narrow toolkit to basically how to handle stress. And unfortunately, the most common tool is using alcohol. So therefore, it's consuming and perpetuating the alcohol use. Now, culturally, we normally think like if a male is at a bar drinking alone, we don't necessarily have a double take. But if it's a female doing it, there's usually a double take and there's more of an intervention. So a lot of times this is normalized alcohol drinking behavior. At Ria, we meet people where they're at. We're not absence-based, and we want to educate individuals to make safer choices around their drinking and really target around the strengths and what are the current coping skills that an individual have and just build on it continuously as they're with us throughout the program. Of course, with telehealth, what we have is we're able to provide much more access. Right now for men, it is fair to say there is a stigma for reaching out for support or help or learning additional tools, but now they can do it in the privacy of their own home as long as they have Wi-Fi connection through their desktop or over a smartphone.